Telemedicine is a healthcare delivery model that leverages telecommunications technology to provide medical services remotely. It has gained significant prominence and acceptance in recent years, particularly due to advancements in digital communication, the need for remote healthcare access, and the COVID-19 pandemic. This approach allows healthcare professionals to evaluate, diagnose, and treat patients without requiring them to be physically present in a healthcare facility. Here is a detailed overview of telemedicine. Core components of telemedicine. Real-time communication. Telemedicine often involves real-time interactions between healthcare providers and patients or between healthcare professionals for consultation and diagnosis. Store and forward. In some cases, healthcare data like medical images or patient records can be collected and stored for later review by healthcare providers. Remote monitoring. Continuous monitoring of patients' vital signs and health metrics through devices connected to the internet, which can be accessed and analyzed remotely. Asynchronous communication. Secure messaging platforms can facilitate communication between patients and healthcare providers when real-time interactions are not required. Types of telemedicine. Synchronous telemedicine involves live, real-time interactions between healthcare providers and patients. It can include video conferencing, phone calls, or even chat-based communication. Asynchronous telemedicine allows patients to submit information, such as photos or descriptions of symptoms, which healthcare providers review and respond to at a later time. Remote monitoring involves continuous tracking of patients' health metrics using wearable devices, sensors, or other remote monitoring tools. Telehealth education. Healthcare professionals can use telemedicine for training and education purposes, sharing knowledge and expertise with colleagues and students. Benefits of telemedicine. Improved access. Telemedicine overcomes geographic barriers, making healthcare accessible to individuals in remote or underserved areas. Convenience. Patients can receive medical care from the comfort of their homes, reducing travel time and costs. Timely care. Faster access to healthcare services can lead to quicker diagnosis and treatment. Cost savings. Telemedicine can be more cost-effective for both patients and healthcare providers, reducing overheads associated with in-person visits. Reduced infection risk. Particularly relevant during pandemics, telemedicine minimizes the risk of disease transmission in healthcare settings. Applications. Primary care. Telemedicine can be used for routine checkups, prescription refills, and general medical consultations. Specialty care. Patients can consult with specialists, such as dermatologists, cardiologists, or psychiatrists, remotely. Chronic disease management. Telemedicine is effective in monitoring and managing chronic conditions like diabetes, hypertension, and heart disease. Mental health. Telepsychiatry and teletherapy provide essential mental health services. Emergency care. Telemedicine can assist in emergency situations by providing guidance to first responders or remote consultation with specialists. Post-operative and follow-up care. Patients can receive post-surgical care and follow-up appointments through telemedicine. Challenges and considerations. Regulatory compliance. Telemedicine is subject to varying regulations and licensure requirements, which can be complex. Privacy and security. Safeguarding patient data is critical, and telemedicine platforms must adhere to strict security standards. Digital divide. Not all patients have access to the necessary technology or reliable internet connections for telemedicine. Quality of care. Remote consultations may lack the physical examination aspect, which can affect diagnostic accuracy. Reimbursement and insurance. The reimbursement landscape for telemedicine services is evolving and can vary by region and insurance provider. Telemedicine continues to evolve as technology and healthcare practices advance. It plays a crucial role in expanding access to healthcare, improving patient outcomes, and reducing healthcare costs, making it an integral part of modern healthcare systems.